A study of untimely sudden deaths and people who took their lives while in the care of the Donegal Mental Health Service has found that almost half died less than 1 month after they disengaged with the services. The study came about following concern within Donegal Mental Health Service about the sudden and untimely deaths of a number of service users. The finding was part of an overall report produced on the study, examining a total of 34 deaths between October 2011 to May 2015. The launch took place at the Education Centre St Conal's Hospital, Letterkenny, and was attended by representatives from the HSE, the community and voluntary sector and various other interested parties. The study was commissioned by the Donegal Mental Health Service, funded by the National Office for Suicide Prevention and conducted by the National Suicide Research Foundation. Both Dr. Clifford Healy, Executive Clinical Director, who instigated the study, and Professor Ella Arensman, National Principal Investigator, give their reaction.
What we found was that in around 2011 we had a change in pattern in the outcomes of people who were coming to our service. Suddenly we were experiencing more deaths in the service, and this raised a high level of concern. We initially thought this might just have been an isolated cluster, that we needed to look at a small number in depth, but as time went on we found that the service user deaths was increasing, and it became really a really pressing problem. So we started to look about making a serious, objective, in-depth local analysis about what was occurring to try and provide as quickly as we could solutions and a better service to tackle what were a number of terrible tragedies occurring for people and their families in Donegal.
For each case of suicide or presumed suicide, we examined at least 4 sources of information, including medical records. We approached GPs who had been in contact with this deceased prior to death. We invited and approached family members bereaved by suicide or sudden death, and the uptake of family members was overwhelming. That was 93%, something we haven't seen before. And also for about half of the cases in that period of time, a coronial inquest was completed, so we also verified the information from the post-mortem records. So for most of these people who died prematurely, we had a complete overview of 4 sources of information. That's very unique. This hasn't been done in Ireland.
I think the results show that we need to have crystal clear, high quality communication with families and services, and that also we need to make the management of risk in mental health in 2016 really across Ireland a cornerstone of what we do, that it's one of the basics that happens as soon as somebody comes into contact with our service and continues throughout the pathway of care they follow when they're with our services.
The entire study can be found on the following link, which is on your screen now. Naomi Doherty, Donegal TV, St Conal's Hospital, Letterkenny.